Hi, everyone. I'm Satvika, one of your hosted committee leaders, and I'm so excited for tonight's event. We're thrilled to welcome our fantastic guest speaker who will share a journey in dentistry.
And I'm Krish. For any new members joining us, Host is a student-led healthcare organization designed to prepare future health professionals. Through our Alliance Academy chapter, we bring in monthly guest speakers from a wide range of medical fields.
Without further ado, tonight's guest speaker is Dr. Anil Kudamula, also Dr. K. And on behalf of Alliance HOSA, we're honored to have you here and so excited to learn your experience. To start us off, could you please introduce yourself and tell us a little bit about your role and field of work?
Hello everyone. My name is Anil Kudumula. I am a dentist practicing in Marietta for almost 20 years. And we are a family of 5 people, my wife, and I have 3 kids. My daughter is a senior at Walton High School, and the other 2 boys are twins, 8th graders at Dodgen Middle School. And I've been practicing here almost 20 years. I'm basically born in India and raised in India. I went to my bachelor's college in India, then came to USA. As you all know, what dentistry is, I mean, what dentist does, I do the same thing every day. So I'm glad uh, I'm here, okay, to help you. Okay.
Thank you. To dive a little deeper, can you walk us through your career journey and what led you to choose this path in health?
Well, like I said, I'm born in India, where the healthcare is not that great at that time. The access to healthcare is very limited in India. So I've been I watched many people going through a lot of healthcare issues. Um, so basically, from childhood onwards, I'm more motivated towards becoming a doctor, not necessarily a doctor, any healthcare professional that can help patients taking their pain away. Okay, so that led to choose my journey towards healthcare. I had a dream of becoming an engineer too. I wish I could. I want to play a dual role too. My dad is an electrical engineer, so I wanted to become an engineer. I was kind of debating between, but finally, part of it is my dad's advice too, because he already an engineer, what to expect in the engineering field, and he just gave me enough advices to walk towards healthcare. So that's basically it. So I continued um, towards my dreams, becoming a healthcare provider. And when it comes to picking one field in healthcare, I mean, then I picked dentistry. I will let you know why. Okay. But that's basically it is why I motivated towards healthcare.
Did you always know that this was like the field for you? And if not, how did you figure it out?
Well, like I said, I was kind of debating between becoming an engineer or a healthcare professional. At one point, I mean, after seeing many people suffering and all this, um, then I thought healthcare is a better provision than engineering. And there are a lot of challenges in India to become a healthcare provider. So we had to go through a lot of exams and everything is very competitive, very limited colleges available in the healthcare sector at that time. So highly competitive, so it's challenging too. So I mean, I like challenges since my childhood. I want to be more motivated toward taking challenges. So those 2 points, I mean, taking challenges and liking healthcare motivated me towards the healthcare. I mean, but it's a lot to know about healthcare. I mean, we can just tell in a few minutes. um, so it's a big journey, a long way. Okay. I mean, I know you all motivated towards becoming healthcare providers too. Um, I know you can accomplish that goal, but at the same time, you need to take a lot of challenges. So I would say you're pretty much at the beginning stage. So way to go. Okay. And you can do it.
So I know becoming a doctor and being your dentist, it's a very long journey. So what are some challenges you faced during your college years or early career, and what kept you motivated through those times?
Well, you know, being a school is different from college. I mean, college, you're like, they treat you like a grown up. Okay. Everyone treats you like a grown up. You should know everything. It's not like you don't have exceptions there. Okay. So that's a big challenge, especially in the beginning. That to going directly a professional college, um, directly from high school, it's that's big challenge. I mean, it's not like here in India. After you finish your senior year in high school, you directly enter a dental college or medical college. So you are like all in sudden you are a young adult to full grown adult. Okay, so that's a big challenge, and they expect you to know. I mean, slowly, but more pace. Okay, so it's not that easy in the beginning, especially those terminologies and all those things. I mean, very challenging in the beginning. And you need to know the full anatomy of your body. It's not just dentistry, not all about your teeth. You should know about top to bottom. So, and terminologies and everything. Well, how I came through? Well, you need help definitely from your faculty and friends. Okay, hard work, dedication, and all these you need to have. Okay, and especially taking charge. Like I said, I mean, taking challenges. I like taking challenges. So every year, every subject, every test is a challenging for me. So when you know your goal ahead, like before you enter the college, and you know that you're going in the right direction towards that goal, then it's easy for you to overcome all these challenges. It's not a big deal, okay? But you need to stay on the track. That's very important. Okay, as long as you're on the track, I mean, no deviations, nothing. Okay, then so basically, I said to myself, okay, this is my goal. Okay, that's it, and we have to work to no matter what it is. Okay, and like I said, challenges are there. Okay, just determination is the key factor. Okay, walking through those challenges.
Before picking dentistry, did you do any like shadowing or internships that helped in shaping your decision for dentistry?
Well, not before starting at the dental college. Um, I saw, few of my family friends, dentists. Okay, I didn't shadow them, but I know about them and I heard the stories about them. At one point, when I was raised in India, when I was in school, dentistry is all about pulling a tooth. So there are no concept of saving a tooth. You got a pain with tooth, that tooth is gone. Okay. So it was like that. Okay. There were no other techniques or anything. So dentistry is not a great profession at that time too. But I did go to their clinics. Okay. But it's not that easy to watch as a school kid, watch a tooth being pulled.
Mm.
Okay, you got it. So it's not that easy. And even though, and at that time, before I entered the college, I wasn't even 100% sure, like we can do it or not. But it's just like well, since I want to take a challenge, and at the same time, I don't want to be like discouraged by shadowing. But I strongly recommend. After I came to US, before I go to dental college, I did shadow. Okay, so I strongly recommend. So I did my bachelor's in India in dental college, and I did my doctor DDS in here at NYU. Okay, so I did both ways. Before entering college in India, I did shadow much, but I just saw them as dentists. But before I go to dental college here, I did shadow dentists, and I strongly recommend doing. And that keeps you motivated towards your goal. Okay, like I said, always talking to a dentist. Let's say you want to become a dentist. You talk to dentists all the time, keep in touch. Shadow them. Okay, it's always good to do that. Not only dentistry, any medical profession. Okay, you will learn. That's the starting point. Okay, so it's just like you get learner's permit. You have your parents sitting next to you, and in driving, right? So someone sitting next to you driving and showing you, and before that you watch them doing. So it's a step-by-step process. Yes, you should shadow a doctor or any medical professional, okay, before you enter college to have a basic idea about what they do, what the medical field is about, and what dentistry is about. Um, yep, I strongly recommend you guys to shadow the doctors. Definitely.
So I want to ask some questions that pertain to maybe your day-to-day life or what your job asks on a daily basis. So what does a daily day look for you the minute you enter your office, for example?
Well, every day is a challenging day. Okay. You see new patients every day. New things come up. Okay. And uh, even though you saw the patient before, he can come back with a new thing. Okay. So there are two things when it comes to daily day. One is clinical, now second one is non-clinical. Okay, so you start with non-clinical, which is okay as soon as you enter the clinic. Enter the office. You get to know what all staff coming that day and how many patients you got and what procedures you're going to do and all those things. And the second thing, clinical, when the patient comes in, okay, that's you're expecting him to come for some procedure, but he may get surprised. He may come up with some other problems, and uh, so you need to address those issues. When the patient comes in pain, you got to issue. You got to address the pain issue rather than talking about smile. Okay, so so it depends. Some days go smooth, okay, like you plan. Some days little challenging, like you need to go their route, but you need a lot of patience to deal with it. I mean, but you will learn all these things, okay? Like I said, I mean, when you shadow, you will learn a little bit of these things. I mean, but every I mean, we work morning to evening. Okay, we see patients. My main goal is to take the pain away. Okay, that's my main goal. So I never said no to any patient that want to walk in with pain. They come in. I still see them no matter what busy schedule is. So in that way, I mean, what you see in the morning at 9 o'clock could be totally different what you see at 2 o'clock in the afternoon. So, like I said, I mean, challenging and every day. It's a daily learning too. I mean, we still learn things. I mean, daily basis. I mean, every day is a learning day. So, so all these things putting together. I mean, so daily a day is a challenging and a learning day for me every day.
To add on to that, what kinds of patients do you typically work with, and what are some of the most common like dental cases you see?
Okay, well, I do general dentistry. I see all kinds of patients. I mean, everything related to tooth. Okay, I see all kinds of patients. But my main goal is, like I said, I mean, taking the pain away. So people, most of the people that come to me come with pain. So I do a procedure called root canal treatment. If a tooth can be saved, my main goal is to save a tooth. Okay. So I do a lot of root canals. Okay. To save the teeth. But sometimes, I mean, they come in a hopeless situation. We can't be able to save the tooth. I mean, then we need to take the tooth out. Okay. So every day, I mean, like I said, people come in different problems. Okay. And at the same time, I mean, some people want beautiful smile. I mean, dentistry is an art. Okay. Every most of the patients want a beautiful smile. Okay, no matter what it is. Okay, some patients, even though they are in pain, they still talk about the smile. Okay, so not to discourage them or anything, we address the like priorities. We set up priorities. Okay, so we sometimes we got to convince patient. Okay, okay, we'll work it out. It takes time. Okay, but at the most common cases that we see is patients with pain. Okay, um, every patient has different expectations as far as health concerned. We need to look into main factors. Okay, it's not necessarily a tooth in pain means not necessarily a tooth has to be in pain. It could be something else related. Okay, a patient could have other health issues, nerve problems that can lead to tooth pain. So we need to look into many things. Okay, but most commonly we see patients in pain. Okay, those are the most common patients that we see and treat. And I do a lot of root canal. That's my main procedure. And my main goal is to save teeth. Okay. So that's all it is.
Okay, so previously you were talking about how you do get in, like how you do get walk-in cases that are unplanned. Did you have any cases that were like memorable or like life-threatening that you'd like to share with us?
Yes. Some patients come with severe abscesses, infection. I mean, they can't even open the mouth. So we got to do like immediate surgery. We need to make an incision, drain all the abscess. I mean, put them on strong antibiotics. There are a lot of cases like that. Okay, we have treated before, um, and imagine. I mean, when they come back, I mean, how happy they are. I mean, that makes your day that day. Okay, when they come, I mean, especially they come on a Monday with lot of pain all through the weekend, and we had to do the surgical procedure. I mean, sometimes we don't have option to send them back. I mean, or send them somewhere. I mean, so those are the patients. I mean that we saw. Not a lot, but quite a few. And the other kind of patient that we see is accident cases. I mean, some people fall, break, especially older people. They don't balance, and sometimes kids. They in play. I mean, they break the teeth and teeth comes out. I mean, I had to actually. A tooth came out for one kid playing in a playground, and they brought the tooth with him. I mean, they called me first, so I told them to put the tooth in the mouth and bring it to me. And they did it. It's an 8-year-old kid, and I was able to put it back in and save the tooth for him. And um, they are very happy. I mean, like, now that's a front tooth. And imagine now that kid is like almost 18-year-old and he still has his own tooth. After it just coming out completely and in the sand, okay, on the ground. And um, that's very happy moment. I mean, when I see the kid now at 20-year-old smiling. Um, so that's a one of the challenging cases that we did. Okay, but it doesn't happen all the time. But there are some restrictions if we can do it or not. But at least we try it. We tried or not. That's more crucial. I mean, so sometimes it works out, sometimes it doesn't. I mean, so it depending on many scenarios. I mean, so that's the main case that I worked, and that smile after 10 years, 15 years is amazing. He looked at me. He still looks at me and smiles and is showing his teeth. It's
That's,
good.
are there any common misconceptions that people have about the dental like to clear up?
Well, misconceptions is, I mean, well, they think, I mean, some people for different reasons, they think tooth is not like their priority. Okay, it could be the finances. Fixing a tooth is more costly than pulling it, so they prefer to lose a tooth. So they don't know the importance of it, of the tooth at that time. So the importance come into factor when they become 75, 80-year old and they don't have teeth to eat and they lose all the strength and they get all the medical issues and all those things. But you don't realize until you get to 80. And so you get only two sets of teeth in your life. Okay, one is baby teeth. Okay, they fall off at the by 11 to 13-year old, and you get the permanent teeth, and you don't get another set of teeth. Okay, so many people don't realize, I mean, that part too. Okay, they think that we're going to, once we pull the tooth we're going to get another tooth. Means like, no, you're not going to get another tooth after 13-year old unless the wisdom tooth. Okay, so that's a misconception. I mean, it's little challenging explaining to them, but dentistry is, like I said, it's not about just smile. It's a beyond smile. Okay, so it's a function too. Okay, so everything starts from your mouth. Okay, if you eat through mouth, okay, so you don't have teeth, you can't eat properly, and you can't digest properly, and your health goes down, and you get all diseases, and you don't want to be in a hospital bed. I mean, so you clean your teeth and keep them clean all the time, and that's saves your life. And imagine how having 80-year-old with all teeth is more healthier than a 80-year-old without teeth. No matter how you go to gym, you do all workouts, and you kind of eat everything, but you can't chew with your teeth. I mean, it's not. We see those patients, but you guys don't know, and the patients don't know until they get into that position. Okay, when they become 80-year-old, they don't have teeth, then they realize what they lost, and they come to us asking for help. And what could we do? We could replace them, but not every patient. Sometimes, I mean, we are helpless. I mean, we can't even do anything because of other medical issues that they got from not eating good, from not having teeth. Okay, so it's all interrelated. Okay, so but many patients don't know that they're all related, and it's all interlinked. And if you lose your tooth, and one you lose one tooth, it affects the other tooth, and you keep losing the teeth, and that affects your medical health issues, and you can't be able to chew, you get other diseases and everything. I mean, you lose your immunity and everything. So so that's always misconception. I mean, like, that a tooth is not important part of the body. A tooth is an important part of your body. Okay, I mean, you can still live without teeth, but not a healthy life. Okay, I mean, healthy life is different from just life. Okay, so a healthy life is only accomplished with healthy teeth.
Are there any like certain skills or like you need to be a dentist in your field to like succeed?
Well, yes, you got to be skilled. I mean, you dentistry, you talk with your fingers. Okay, so your fingers are the main machines in dentistry. So your skills starts there. Okay, so you, it's an art. Like I said, it's an art. Dentistry is an art. Okay, so fixing the teeth, I mean, you're working, I mean, the tooth is like this small, and you're looking into the tooth and have to fix it. I mean, pulling the tooth is an easy thing. Okay, but fixing a tooth is making a hole through the tooth, and so you need a lot of skills. Doing root canals and other stuff, doing a filling, other stuff. So you are, you need to be artistic. Okay, so you are like a artist when it comes to dentistry, just like a plastic surgeon making you beautiful. I mean, fixing. So you can check your smile. I mean, so everyone. I mean, without teeth. I mean, I don't even think they can smile without teeth. I mean, so not, no one want to smile without teeth. I mean, so everyone want beautiful smile. Okay, so that's the main thing. I mean, uh, I'm not sure about you guys, but whenever I look at someone, my eyes automatically look at their smile, their teeth. So as far as skills wise, yes, I mean your fingers linked to your brain, and your skills matter. I mean, very important. I mean, so you need to be like artistic fixing teeth.
Okay, that's great to hear. So now we're gonna move on to for students. So I know you did your beginning, your undergraduate in India, but what are some high school or college courses that you feel would help people prepare the most for this type of career?
Well, there are a lot of. I went to college directly here. I didn't go to high school here, so I am not 100% sure about high school course. I mean, biology is main. Obviously, you all know. Okay, then I don't separate anything. Okay, but as far as I am concerned, okay, I my favorite subject is math, and then physics, and well, chemistry and now you need all these subjects: math, physics, chemistry, and biology. All four are very crucial. Okay, so biology is main. As you know, you want to become a doctor. I mean, everyone wants every college want to know about your biology skill. I mean, your excellence in biology. And as at the same time, I mean, you need to know of physics, chemistry, and math also. Okay, they all interlinked. Nowadays, there are more subjects. I mean, you guys know better than me on high school level. But as far as it comes to college, the physics, chemistry, biochemistry, and biology, these are the main courses that helps you going through the college level. Yep. Hmm.
Yeah, what are some qualities that are essential for someone who's in dentistry? Like suppose what are some qualities that you think are like, hey, this is very important for someone who wants to pursue dentistry?
Well, qualities. I mean, first of all, you need a strong goal and determination towards walking that goal. And you need lot of patience. Okay, it's not that easy. I mean, many people give up at that level. Okay, so expect an unexpected. Okay, so things go wrong, but you need to know how to troubleshoot it. Okay, how to bring it back. Okay, see, like when we started, I mean, today's meeting, I mean, things didn't go in our way. So, but do you guys know how to fix it? I mean, same thing. I mean, you guys should know, be prepared to fix the unexpected. Okay, so um, but mainly you need to set up a goal. Okay, and you need a lot of determination working towards that goal, and you need a lot of patience. I mean, it takes long time. I mean, you guys know how long it takes to become a full-fledged doctor. I mean, so don't you think a lot of patience needed to go through all these years? Okay, so that's where you should not give up. Okay, so don't look at other people. Okay, so if they're making money or they're doing jobs or anything, so just look at yourself. Okay, and look at your goal and a strong determination and lot of patience that uh, keep motivated yourself. And obviously I would say your professors and I mean teachers and family, I mean parents, I mean they got lot of experience than you. Obviously they are going to guide you in right path. I mean sometimes you need to listen to them. Okay, even though you know things better than them, but sometimes they are experienced than you guys. Okay, so that everything matters. Okay, when it comes to healthcare.
If you could give one piece of advice to your younger self or to high schoolers who want to pursue healthcare, what would it be?
Um, like uh, like I said, expect unexpected. That's number one. Okay. And second thing, I mean, I didn't mean to say this, but you always should have backup plan. Okay. I mean, no matter how good you are, sometimes things um, things doesn't go in your way. Okay. So you should have a backup plan. I mean, that's what I think. Like you guys apply for example. I mean, you guys apply for like 20 colleges. I mean, doesn't matter how good your GPA is, and still you need to have a backup college plan. I mean, same thing. Okay, so nothing wrong having a backup professional plan too. Okay, like let me give you an example. Okay, you want to go to a medical college. Okay, worst scenario, if it didn't happen, I mean, things can change. I mean, you may want to go to dental college or at least biomedical engineering or anything like that. So always have backup plan. That's what I advise. I mean, you guys. I mean, that's my advice to you all. You okay? But like I said, expect unexpected. Unexpected is always okay. You know how to troubleshoot on keep yourself on a track. Okay, sometimes the track that you choose may not work for you. Okay, you may have to go halfway through, and then only you realize. So having a backup plan makes your track change easy compared to just standing there and staring here and there. I mean, what to do next? So, so that's my advice. Okay, having a backup plan. And same thing I did. Okay, initially I wanted to become like a medical professional, like a doctor. Then things changed. Okay, then I chose dentistry. Uh, but I had a backup plan. Like it's a totally different field, but still I had a backup plan of becoming an engineer. Okay, so um, especially when you are adult, then you can't have excuses. Okay, so you treat yourself as an adult when you are in high school and come up with a backup plan.
Do you see yourself getting any further specializations or further training in the?
Well, we do our continuing education courses every year. Okay, so we update ourselves. Okay, technology wise or skills wise, we have to update every. It's a part of our profession. Okay, it's not just me. Every dentist, every medical professional, they have to do some continuing education courses. As far as specialization is concerned, okay, I mean, every year we try to do something special. Okay, like I say, example, I mean, if I'm doing a root canal this year, I mean, I may be doing implants next year or doing full mouth reconstructions. So people who don't have any teeth, I mean, placing implants. So it's a daily challenge. Every year, every day, something new comes in. So we need to update ourselves. Okay, so I mean, people who still practice old kind of dentistry, like doing metal fillings. I mean, not doing white fillings, but most of them they update themselves. I mean, it's just like your old car, you need to trash it, get a new car. I mean, you need to update yourself. Okay, you can't drive the old car on the road. Okay, so as far as specialization is concerned, okay, like I said, I do a lot of root canals. Okay, which is saving the teeth, but I am moving towards specializing in placing implants, because saving teeth is one part, and rest, I mean, replacing teeth is the other part. I mean, saving teeth when they have teeth. Once they lose the tooth, we need to replace it. So the implants is one of the best options. That's where we are. But every day something the new comes in the implants. I mean, material wise and technique wise. Um, so I've been um, upgrading myself since ever I started working in dentistry, and it will be keep going. I mean, until I retire. Okay, so so it's every day is like a new day. Okay, like you see new thing, you need to update yourself towards the new thing. Okay, so all the whole dentistry itself is a specialization. It's like you're working only one part of your body. So in that, I mean, there are more micro specialties. Okay, like placing implants. Sometimes they fail, and if you know why they fail, I mean, it's easy for you to troubleshoot. Okay, so like that. Okay, so every day something the new comes in. Okay, so we need to update. We keep updating. Okay, just not me, everyone, every dentist does it.
So I heard you mention that you studied in New York for your medical college, and not a lot of people maybe want to stay in Georgia when they grow up. So, what were some cultural differences, or some differences, or lifestyle changes that were different in New York than where you live right now in Marietta? And looking back in hindsight, what do you prefer more, New York or Georgia?
Well, I went to New York University. Okay, and I lived in New York. You know how costly, and we graduate with thousands of student loans. Okay, to live wise, I mean, if you have money, New York is the best place to live. Okay, but after graduating with hundreds of thousands of loans, I mean, obviously you need to look for a place where you can save money, and you build your life. And on top of it, weather, another option, another thing that I choose for a warm weather, because I'm born and brought up in India, like a warm country. So I told myself to move south. Okay, and so there are a lot of things that played in role. Okay, and also I came on a student visa, and I needed a work visa. So I need to look for a someone employer that can employ me initially, um, to sponsor H1 visa. So all these things, okay, made me move to South. I mean Georgia. I mean, I didn't. Georgia is just one of the places in my list to move when I was in final year of my college. But when I went all around, I mean, look for different places. I mean, I felt like Georgia is not too warm, not too cold. And dentistry wise, I mean, not many dentists in Georgia when I came 20 years back. Okay, but we have one thing. We had only one dental school in Georgia, in Medical College of Georgia, the Dental College of Georgia. Um, so not many dentists in Georgia practicing at that time. So obviously, I thought I can excel better in Georgia, and that made me move here. I mean, New York is my favorite place, all time favorite place. I mean, still love New York City, and I have seen more diversified patients. I mean, different places of patients from different nations, uh, different uh, different problems. I mean, I have seen a lot of patients in New York. I mean, you don't see those many patients here, but in college it's different. in real life practice. Okay, so in practice you're by yourself. I mean, in college, I mean, you have someone watching you and behind. I mean, if you do something wrong, and they can fix you. But in real life practice, I mean, it's no one to fix you. You need to know how to fix yourself. Okay, so you need to know how to troubleshoot if something goes wrong and all those things. Okay, so um, it's easy. I mean, the patient, once you start, well, you need to start somewhere. Okay, so I started here and I liked it here and I just stayed it. But I never thought I'm going to be practicing in Marietta, Georgia for 20 years. That wasn't what my goal was when I started practicing in Marietta. Things worked well for me, okay, but after going through a lot of challenges, okay, like in India or here, I mean, I did my master's in public health too in Kentucky. So I lived in Kentucky, Bowling Green for 2 years when I was doing my master's in public health. So I was thinking I had a plan, like a backup plan. Like I said, I always have a backup plan. My main plan is to practice dentistry. My main backup plan when I was in India, like I told you, engineering. But here, after coming here, engineering I can do it. Okay, so my backup plan is, have you ever heard of CDC? Okay, Center for Disease Control. I mean, CDC, we have main quarters here. So I have master's degree in public health. So if dentistry doesn't work out for me, okay, I have a backup plan to join CDC with my master's degree in public health. So these all contributed for my move to Marietta in Georgia. And glad, I mean, God's grace or whatever you say, I mean, things worked out in my way, okay, and I didn't get to move out from here. So hope this continues, goes, okay, until I retire.
So a couple years back, since there's no more member questions, I think I have time to ask you this. So a couple years back on Netflix, there's a documentary called Root Cause, and now since then it's been removed. But I'm sure you can still find it on YouTube. And on the documentary, it said that like many people after they got root canals, they like started facing like many problems. And like there was one guy that said like he started like having like a lot of like depressive symptoms after getting a root canal, and he didn't know why, but he went to all these therapeutic things and this and that, and then eventually he's like, after I got the root canal I started having all these things. So was there like any testimonials you saw like that of your former patients that had trouble with root canals?
Yes, I mean, and the treatment, any treatment that we do, not only root canals, okay, it's not like we can't guess how it's going to turn to be. Okay, everything looks fine. We take x-rays, we make sure we did it right. I mean, the root canal went through and everything. Like I said, okay, when it comes to, we are helpers. We help to, to maintain your health, okay? But ultimately, it's your body need to fix the rest. Okay, we do surgery. Okay, we cut your skin and do whatever we do, but ultimately your body need to heal. Okay, like I said, I mean, if you're not in good health, okay, you're not going to heal good. You have other medical conditions going on. That's why we check. I mean, when you enter a college, you need to know the whole body anatomy. Okay, so at the same time, when a patient comes in doing a root canal, okay, on you could be different from on an 80-year-old. Okay, because you are healthy, no problems. A 80-year-old health can have many problems. Okay, so she may be taking different medications and all those things. I mean, a root canal may not work for her, but at least we try. I mean, that's why I said, I mean, you need to know how to troubleshoot. I mean, if something goes wrong, okay, so you have to fix it, okay. So, like I said, I mean, no, I'm not saying every root canal that I did so far worked well. I mean, no issues, nothing. There are root canal that fail with me too. I mean, you if you say your root canal never failed, that means you're not doing a right root canal. Okay, ask any dentist, they're going to say this. Okay, so problems are there everywhere. That's why I said you need to treat it like a challenge. Okay, and at the same time, how you educate patient is very important. Okay, you do a root canal. Okay, you need to tell patients, okay, this is the precautions. I mean, this is what you should do. You should expect down the road. Okay, you may be good for 10 years. Okay, but if you eat by something hard, I mean, you abuse your teeth, I mean, they can break, they can fail. People, example, okay? You go through a lot of stress. You don't sleep good. So when you go to deep sleep, okay, people grind their teeth. Okay, I don't know how many people, how many of you know about this. It's called night grinding. So what happens? You grind your teeth, okay? That means you are walking daytime, okay? You keep walking in sleep too. Okay, so your body get tired, same thing, your teeth get tired and they give up at one point. Okay, so you need to know what's the main problem, why he need root canal. Okay, so you need to treat that problem. Okay, so if a tree is growing, if it's drying up, okay, putting pesticides or something is not important. So it could be problem in the roots. Okay, so you need to treat the main root cause than fixing the tooth. Okay, so without wearing a night guard, okay, you do root canal, crown, and all these things, the patient is going to break and the teeth is still going to break, no matter how good you are at fixing their teeth. Okay, so that's just one example. Okay, people smoke. Okay, is it good? I mean, it's not good for your health and it's not good for your teeth. Okay, so people chew ice cubes. Okay, what do you say? Okay, so you need to know all these before you do any treatment. Okay, that's why I said expect unexpected. Okay, everything you think everything went well and you did perfect job, but patient come back and with more pain because they have something other going on. I mean, they chewed ice that day or they ate something hard and they grind their teeth. I mean, they don't wear a night guard. Okay, so all these things come into picture. Okay, so when you're trying to fix a tooth, okay, so let's say you broke a bone. Okay, they put a cast not to move your leg. Okay, so you got to keep it in. I mean, you can't keep jumping. Okay, like you did before, right? Okay, I mean, you got to follow their instructions. I mean, if you move your leg, I mean, without cast, the it's not going to heal. Okay, so you can't go back to the surgeon saying the treatment failed. I mean, it is failed because you're negligent. So, and at the same time, it's not necessarily the patient's negligence. Okay, sometimes it can happen too. Like they don't know that why it happened. Even the doctors don't know why it happens. Okay, sometimes it's just like a cancer. Okay, you don't know why you got it. You're a perfectly healthy man. Okay, but you can still get it. You're not an exception. Okay, genes, okay, could be a problem. People, I had lot of patients that said they brush their teeth real good every time they eat, floss and everything. Okay, they do perfect job and they come to dentist and get their cleanings done periodically. They do everything that we tell them to do, but the treatments still fail. They still lose the bone and the teeth becomes loose. Why? It could be the genes that came from their parents, which we can't alter or you can't alter or patient can't alter. Okay, so there are some things, it's not in our hand or anybody's hand. So when you will know all these things in college. Okay, so when it comes to the treatment, okay, you have to be prepared to expect and unexpected. Okay,
So thank you, Dr. Anil, so much for your time tonight and sharing and answering all our questions. We've learned so much today and it's been truly inspiring.
Okay, thank you so much for having me. Okay, and I wish you all good luck for your future. Like I said, number one, have a goal. Number two, determination. Number three, challenge. And always have a backup plan. Okay, these are the key points. Okay, okay, and I wish you good luck and have a nice night. Okay, take
Thank you.
care.
You too.
Okay, okay.
We're now going to display the QR code for attendance, and please make sure this is completed by tonight to receive the guest speaker credit.